is something we all have to deal with, and that is our health. Navigating the healthcare system can be overwhelming. There's a great new book. It's called The Patient's Playbook. It offers a prescription, if you will, to help make sure we're getting the best care. The author, Leslie Michelson, is here, and we're also joined by the director of the leukemia program at the New York Presbyterian Weill Cornell Medical Center. Also happens to be my doctor as well, Dr. Gail Roboz. Thank you both for being here, and thank you for putting this on my radar, Gail. And I'm telling you, I know that you're interviewed for it. Leslie, you have worked in the healthcare industry, and you have found that there are many things that can help people, and you put it all here in the book. And I think people are going to be surprised by the number of medical errors that are out there and that we need to be aware of.
Yeah, it's a huge problem, Robin. Preventable medical error is the third leading cause of death in the United States, right behind heart disease and cancer. We lose 400,000 Americans each and every year to preventable error.
But no one ever talks about that.
No, and the reason they don't is it happens quietly. Mrs. Knarsick in an assisted living facility succumbed to pneumonia, but they don't tell you about it. There's no crash site, there are no sirens.
And you want to help put an end to that. And Gail, you talked about it, and the reason that you reached out, you said everybody should read this. It doesn't matter where you are, if you're well or not, this is a book for you. Why?
I can't think of who wouldn't benefit from reading this. You don't have to be a patient, and you don't have to be sick. This is for patients, it's family members, it's for well people trying to figure out what to ask their doctor. It's for doctors to read and take a look and try to figure out what the patient as a consumer and as a self-advocate needs to get from the doctor.
And even that tells you what kind of vitamins you should take. I mean, it really gets down to the basics and all levels like that. But you really start, and this is so true, with the quarterback, the primary care physician. Leslie, you talk about over and over that is key in finding that person. How do you go? Why is it so important? And how do you find the right one?
Absolutely. Your primary care physician should be the quarterback of your healthcare delivery system. That's the person who should listen to your symptoms, help you find the right experts when you need them, and become your partner in wellness, helping you manage your cholesterol, your weight, your blood pressure, so you live a longer life.
And how do you go about finding that person?
There's 3 straightforward steps, and I talk about them. The first is take out a piece of paper, make a list of the things that are most important to you. Is it the insurance coverage? Is it the location? Is it the hours they have, the hospital they admit to? Second, talk to friends, relatives, neighbors, and your physicians. See who they use, see who they think. And then third, make an appointment, do a consultation, interview the physician just the way you would every other important professional in your life.
I mean, when you're going to buy a car, you go to all these different dealerships, you try and get the best deal, you ask friends and that. If you're buying a home, you want to be in a good school district, but yet when it comes to our health care, we don't take those same precautions. We have said over and over in this show, ask your doctor questions. What is the #1 question we should ask when looking for a doctor any kind of way?
You know, I think you can say, you've seen me, you've read my records, you know my story. What's your plan for me? And see what the answer is to that question. What do we do now? What is your plan for me? What is my action? What do I have to do? Who do I have to see? What do I have to eat? Do I need a specialist? What's your plan?
And when you're talking about a specialist, because you know both of I know there's some people at home and saying this all sounds well and fine, but you know what? I can't afford that. I can't afford to find a specialist. I can't do that. There are resources, aren't there, Leslie?
Well, first of all, the best medical care doesn't cost anymore. Most Americans live near major cities. In every major city, there's a major academic medical center, most of which take all kinds of insurance coverage. So one of the secrets about healthcare is it doesn't cost more to get the very best. And there's terrific resources to find the best experts like Dr. Roboz. The first is a website called expertscape.com, where they've organized all the medical literature over the past 10 years. All you need to do is put in your diagnosis, the city you live in, and instantaneously you'll get the identities of the physicians in the hospitals who've done the best work. The second is all the major hospitals now have terrific websites that list the specialties of their physicians. And third, we're a very generous society. We have philanthropies for every single disease, and each of those disease-specific philanthropies has resources and materials to help patients that have been diagnosed with it. All these resources are free for everyone.
And that is so very, very important. I know you've been looking over me because I have my I know I need to come in and get my flu shot. You're looking at me and she's looking at me as my doctor right now and get into that. But Thank you very much, Leslie and Gail. It is so vital, and again, you don't have to be sick to be able to get something out of this book. I'll come in and see you real soon, Gail. Thank you, Leslie.